Hey Laba! Welcome to Let's Talk Diabetes with Mirabekono. In this video, I will be explaining how you can limit diabetes food problems in 10 tips. If you are new to this channel, I am a registered nurse and a diabetes educator. And my channel focuses on everything diabetes, how to manage blood sugar levels, and also nursing. So if this is a kind of content you enjoy watching, make sure to hit the subscribe button and keep watching. As a diabetic, you might have heard 110 times from either your doctor or the diabetes educator that you have to take care of your feet. It is not for nothing that we ask you to take care of your feet. High blood sugar levels can cause nerves damage over time, resulting to diabetic neuropathy. By the way, I made a video about diabetic neuropathy guide. If you haven't watched the video, I will leave the link in the comment section. Then you can watch it if you like. This will give you a guide of what diabetic neuropathy is and also the possible solutions to prevent or manage diabetic neuropathy. In addition to nerves damage, high blood sugar levels can lead to narrowing and hardening of the blood vessels, which causes poor circulation of blood. As a result of this poor circulation, wounds on your feet can develop into serious complications. Knowing what high blood sugar levels can do to your feet is also important for you to know the symptoms of foot problems so that you can identify them on time and take measures. The symptoms of foot problems can be burning feeling, pain, cramps, tingling, and sometimes also you can experience deformation in your feet and toes. Now that we have seen why you should take good care of your feet and also the symptoms of foot problems, let's see how you can limit diabetes foot problems using the following tips. Number 1 tip is for you to inspect your feet daily. As a diabetic, you need to check between your toes and under your foot for red spots, infections, swellings, ulcers, bruises, calluses, or inflammation signs. If you cannot get a good look at the bottom of your feet, use a mirror or allow someone to check your feet for you. Tip number 2 is for you to wash your feet daily with soap and lukewarm water. Not hot water, but lukewarm water. I will explain this further in the course of this video. Tip number 3. After washing your feet, dry your foot well. Make sure to dry in between the toes. Hydrate your feet with body lotion. But do not apply body lotion in between your toes, as this will cause maceration, which can further lead to bacterial infections. The next tip is for you to take good care of your toenails so that they don't protrude above the edge of your toes. Cut your nails straight across. Do not cut your nails following the shape of your nails. Also, do not use nail files and nail cutters to cut your nails. Use nail scissors. The number 5 tip for you to limit diabetic foot problems is for you to wear clean, dry cotton socks without wrinkles or holes. Make sure that your socks don't strain your lower legs. My number 6 tip for you to limit diabetic foot problems is for you to wear comfortable shoes. Wear comfortable leather shoes without heels. In the process of you wearing your shoes, make sure to wear your shoes gradually. So take your time while wearing your shoes. Make sure to inspect your shoes to see if there are sharp instruments inside your shoes. Talking about comfortable shoes, my bonus tip for you is when you are going to buy shoes, make sure to buy your shoes in the late afternoon. When you go to buy your shoes in the late afternoon, the possibility is high that your feet are slightly swollen, which means that these shoes will definitely fit you even if your feet are no more swollen. But if you go to buy shoes early in the morning, then the possibility is also high that In the course of time, these shoes will be small for you. Take this tip along with you whenever you are going to buy your shoes, that you have to buy your shoes in the late afternoon when your feet are slightly swollen. The next tip is, do not use hot water or electric towels and blankets on your feet. In tip number 2, I promise to explain further why you need but lukewarm water to wash your feet. This is because when you use hot water, electric blankets and electric towels on your feet, you might incur injuries without knowing due to diabetic neuropathy. So avoid using hot water, even hot materials on your feet in order to prevent burns. Next is, do not remove calluses by yourself. If you have calluses, it is advisable for you to consult a medical pedicure or a podologue for them to remove these calluses. Do not attempt to remove them by yourself, depending on the country in which you are. For instance, if you are a diabetic in Belgium and you are in the Zorgtraject, then you have right to a podologue 2 times a year. A podologue is someone that is specialized in food care. A podologue can easily determine food problems and also take action to what you can do to prevent them from further complications. Number 9 tip is for you to stop smoking. You might have heard several times that smoking is not good. Yes, smoking is not good, especially when you are a diabetic. Smoking destroys your blood vessels, and for a diabetic patient, this is serious. So stop smoking in order for you to prevent diabetic foot problems. The number 10 and very important tip for you to limit diabetic foot problems is for you to bring your blood sugar levels under control. There is nothing so important when you are a diabetic as bringing your blood sugar levels under control. When your blood sugar levels are under control, then your chances are also high not to have foot problems. If you have high blood pressure, high cholesterol, do your very best also to bring them under control, as this will help prevent diabetic foot problems. You've heard it all in this video. Why you need to take care of your feet, the symptoms of diabetic foot problems, and more important, how you can limit the risk of getting diabetic foot problems. If by any chance you discover that you have either 1 or 2 symptoms of diabetic foot problems, do not hesitate to contact your doctor or your diabetic foot specialist so that they can take fast action to prevent further complications. It is of great importance as a diabetic patient to allow your doctor or your diabetes specialist to check your feet at least once a year. This will enable them to trace early signs of foot problems such as diabetic neuropathy. In my subsequent videos, I will be explaining how to do a diabetic foot test, also known as the monofilament test. So make sure to stick around. Now that you know these tips, make sure to apply them in the comfort of your homes. In case of any problems, do not hesitate to contact your doctor and also your diabetes educator. So that was it for this video. If you found this video helpful, give it a thumbs up. Share it with your family and friends. Subscribe. Do not forget to click on the notification bell. Select all so that whenever I post a video, you will get a notification. Stay blessed. Stay healthy. I see you on my next video. Salut! Bye!